All right, fantastic. So we are recording now. Again, thank you so much for tuning in. Great to have you out and tuning in to this very important topic in this information. So look, I recognize that I probably have four groups of individuals that are here and going to be tuning in. This is a big, heavy topic, okay? And maybe not the easiest to talk about for some individuals. Maybe you have been impacted personally. Either one, maybe you've been on opioids before, and so you're curious to learn more. Maybe you currently are on opioids and you want to learn more and other strategies. So maybe you want to get off of those opioids. And maybe you have a family member, a loved one, a neighbor, coworker, friend that is struggling with this issue, and you want to learn more to help them out. Or probably the fourth group of individuals is that you're a seeker. You are looking to gain health and wellness knowledge so you can continue to make the best choices for your overall health and well-being so that you can be as healthy as possible. So whatever category that you're at, or if there's another group of individuals that I totally missed there, either way, you're in the right place. Super thrilled and excited to have you here. This is a passion of mine because there is a crisis going on. Many of you have been reading in the news here today, regarding COVID. It's been going on the last 18 months and everything with that. Well, there's other crises going on that are arguably just as important. And this topic of opioids and opioid abuse is definitely up there at the top. And it's not getting the recognition in the media that I personally believe that it deserves. It kind of gets buried in all the COVID stuff and pushed off to the side. And as you'll find out and you'll discover that this problem has only gotten worse over the past 18 months, pretty dramatically here. So why am I passionate about sharing this information too? Because as a chiropractor, I'm a wellness expert, and I boldly am stepping out to talk about a problem, a big crisis that's happening in our quote unquote healthcare system. Because if you've been following anything recently, you realize that we do not have a healthcare system. We have what's known as a sick care system, where we just constantly treat symptoms and we manage symptoms, and we're not addressing the root cause of the problem. And if anything, we learned over the past 18 months and COVID stressing the system is if we didn't already know, we then learned that Americans and people at large around the world are not healthy, and we are sick individuals in this country and around the world. And so when the virus comes to town, it attacks weak individuals, weak immune systems, and we can see what kind of chaos and havoc that can wreak in people's lives. So we want to have a health conversation tonight, and what I'm sharing with you is all about health. It's about what you can do to be healthier and stronger, and then by doing so, keep your body away from pain and not needing to rely on these type of pain meds. So whatever group that you're in, and as we get into this discussion here, I just want to let you know that wherever you're at, there's no judgment. There's no shame, with this subject that we're going to be talking about. And so if you didn't know, then just now you know. And so by having better information, you can make better decisions towards your overall health and well-being. This topic also is, personal, meaning that I have never had a problem with opioids, and none of my family members, as far as addicts, have had any issues with the opioids. But, I come from a family of addiction, and specifically alcohol. And so my grandparents on my dad's side of my family were recovering while they were alive, alcoholics. And so there was alcohol abuse in our family. And then my dad, who is one of my greatest heroes in my life, is a recovering alcoholic. My dad has been sober now for 40 years. I grew up learning principles of addiction and a way of living to help get through addictions such as alcohol. And I myself have just almost 16 years ago decided not to have any alcohol in my life. I gave that up because it wasn't serving me. And so 16 years without any alcohol, and knowing my family history and knowing the possibilities of addiction. And so I didn't want to have that in my life, especially as being a doctor and a professional and raising a family and then with my kids. So if you are struggling out there and this is an addiction for you, I just want to let you know, I understand you're not alone. You're in a safe place. And if you know anybody that is struggling out there with this addiction, there is opportunity to get help. And so I'm going to share some very powerful information with you tonight. And we know that information is power, but only if you use it. So it's on the application of this information, not only in your life, but sharing it with others. We can help create a healthier and stronger family and a healthier and stronger community here. So let's dive into this crisis. Let's talk, let's have an important conversation about where we're at. We're going to do a State of the Union and where we're at with this opioid crisis, and then give you some suggestions of what to do to a better way of living, a better way of health and happiness into the future here. So let's see here. Okay, just so we're on the same playing field here, we're going to be talking about chronic pain. And what I mean by chronic pain is that you've had pain for more than 3 months. And so when we're talking about pain, people are seeking answers to their pain. Some of it could be masking their pain. Some of it could be getting to the root cause of their pain. We'll dive into those paradigms in just a moment. But when you're in pain, people are seeking ways to get out of pain. It could be neck pain. It could be low back pain. It could be headaches. It could be pain going down your legs, such as sciatica. It could be arm pain, any pain in between here that you're seeking comfort from. Remember what pain stands for: pay attention inside now. When you're in pain, your body gets into a fight or flight stress response. It's a survival mechanism to help seek comfort getting away from the pain, because when you're in pain, your body is in an alarm situation here. Now, when it comes to pain, there's allopathic option. As I mentioned, is that we don't have a healthcare system. We have a sick care system. So within that sick care system, these are some of the things that they may be recommending for acute pain. It could be chronic pain. It could be heat and bed rest. It could be drugs, steroid injections, pain management, surgery. Are there any alternatives? Well, tonight we're going to stay in the lane of the drugs and then talk about specifically opioids and how that is destroying individuals' health, destroying families, and destroying communities, and eroding our health in our country and in areas around the world. So prior to the COVID situation, this was starting to make its headway around 2016, 2017 into more mainstream media. And now you don't really see this anymore. At least I'm not seeing it. And if it is there, it's buried. But I start to question, why is this being hidden? Why isn't this out more in mainstream? Why is the media not talking about this? Why aren't we having more crucial conversations about this? So a little bit of background on what opioids are. We're going to go ahead and then play a very short video just to kind of ease you into understanding what these drugs are, why they were invented in the first place, and let's get started here. So if you are at your computer or listening in, make sure the volume is up. You should be able to hear this, no problem. But let's go ahead and get this started.
We've all heard about the opioid epidemic, but what are opioids and why are they such a big problem? Opioids are basically a type of pain-killing drug. No one likes pain, right? So why wouldn't you want to take a drug to help relieve it? Well, I'm going to answer that question by asking another question. Do you think heroin, which is an opioid drug, is good for you? In case you're unsure how to answer that question, let me first list some of the effects of taking heroin: nausea and vomiting, itching, insomnia, infections, abscesses, constipation, liver, kidney, and lung disease, mental health problems, problems with sexual function, and to cap it off, death. And I'm not just talking about a few deaths. Heroin kills thousands of people every single year. I think we would all agree that this highly addictive drug is bad for you, right? You might be surprised to know that heroin was produced over 100 years ago by pharmaceutical companies as an alternative to morphine, because morphine, which is also a painkiller and another opioid drug, was causing too many problems with addictions and overdoses. It was thought at the time that heroin was less addictive than morphine, so it would be a better option. Now, that thinking was simply wrong. You may be wondering why I keep talking about heroin. Well, fast forward to about 20 years ago. New types of opioid drugs began to emerge, and they were thought to be more beneficial and less addictive than heroin. You might have heard the names of some of these drugs: tramadol, OxyContin, codeine, and Vicodin, just to name a few. In reality, modern-day opioid drugs are similar to slow-release heroin. They are highly addictive, and they're associated with major withdrawal symptoms, and they're killing more and more people every single year. When they were released, these new opioid drugs were falsely marketed to doctors as being an effective pain reliever with a low risk of addiction, and they quickly gained popularity for the treatment of chronic pain. Chronic pain is pain that has been around for more than 3 months. As it turns out, though, they provide minimal relief for long-term pain, like arthritis or chronic back pain. In fact, there is no good quality scientific evidence that shows that they have good long-term benefits for managing pain. What there is good evidence for is that prescription opioids cause significant harm and thousands of deaths every single year. In 2018, there was almost 50,000 opioid overdose deaths in the US alone. This is why current guidelines say that opioids are not the answer for chronic pain, and they should be avoided. So I think we can all agree that opioids should not be your first choice option when you are in pain, and should be avoided wherever possible, because there are much better choices out there. So what can you do if you're in pain?
Okay, so a lot of great information in there. We're going to get to the second half of this video further into the presentation. But there's a lot of surprising statistics and alarming stats. So let's dive into this. 100 million people in the US suffer from chronic pain, which is 1/3 of all Americans. This affects quality of life and is a leading cause of disability. 136 Americans die every day from opioid overdose, and opioids are prescribed for a variety of causes of pain. So as we talked about, opioids are drugs that act on the nervous system to relieve pain. The opioid is a chemical that works by binding to opioid receptors, which are found in the central nervous system and the GI tract. Receptors in these two organ systems bring about both the beneficial effects and the side effects of opioids. So you might know it as Vicodin, OxyContin, Percocet, fentanyl, things like that. Now, the analgesic effects of the opioid are due to decreased perception of pain, decreased reaction to pain, as well as increased pain tolerance. So patients will ask, Doc, should I take drugs? Should I take opioids? And we always need to ask is, well, what's your goal? We need to talk about what your goal is. Because if your goal is to reduce pain, then maybe they might be effective in helping to reduce the perception of pain, maybe. But the side effects of the opioids include sedation, respiratory depression, constipation, addiction, and death. So I don't know about you, but I'm not sure that it's a good idea to compromise our respiratory system these days, especially with everything going on with COVID. You do not want to be immunocompromised. These drugs will actually reduce the strength of your body. And just remember that every drug out there has side effects. There's not one drug out there that does not have a side effect. In fact, anything foreign that you put into your body, whether it comes in a shot or a jab or a vaccine or a drug, everything there will always have a side effect. So how bad is it? Well, 80% of Americans will experience back pain at some time in their life. And at any given time, 35% of Americans experience this here. And 54% of low back pain sufferers are desk workers. Sitting really has become the new smoking. And 50% of women experience back pain when pregnant. So there's a cost to this. There's a direct and indirect cost, $50 billion in direct costs, $50 billion and $100 billion in indirect costs. Is there any wonder why we have such a healthcare or sick care crisis that we continue to spend trillions of dollars? About $3 trillion is our healthcare burden every single year. Yet Americans are becoming sicker and sicker and weaker over time. But then it also has consequences on people's life, such as missing work. They're not being able to play. They stop doing what they love to do. And then by missing work, it could be loss of productivity, your job, losing income. You stop exercising. You used to have an active lifestyle, and then that all creates a downward spiral. People start living around the problem and stop doing the things that they love. But it can get much worse than that, is what we're talking about with the opioid crisis. You get real pain, you're suffering, and it leads to drug use. And then you start by innocently popping over-the-counter drugs, and then it becomes prescription pain pills. So you're needing something stronger, and that's not doing it. So you get illicit street drugs, and it just keeps escalating along the way. This is one of our nation's biggest crises right now, and I'm concerned that many heads that are in power when it comes to leading the charge on our healthcare system are turning an eye to this in the way of profits. More on that later. So look at this. This is the DEA approved production of these opioid drugs here. So you can see from 1993, and you can see a steep incline to 2016 of just how the production and sales of opioids have absolutely gone through the roof. So this means more profit for the drug manufacturer, and it means more deaths from the American people. See, I left this slide, and this is in 2010, is that 40 people a day were dying from narcotic prescription overdose. And COVID came around and stressed the system. If you want to see how good a system is, such as the United States healthcare system, which we established is really a sick care system, you stress the system. And in 2019, so remember, 40 people dying a day in 2019, then you had 50,000 deaths a year due to misuse of and addictions to opioid described as a national crisis. And that's almost 140 lives lost per day. Then if you take a look from December 2019 to December 2020, through this pandemic, there were almost 100,000 estimated overdose deaths. That's almost a 30% increase to 255 deaths per day. Think about all the chaos and the stress and the worry and the fear, the anxiety, the isolation, the pain that it caused, the ripple effect in people's lives when it came to our economy and jobs and situations. Devastating. You can see following from 1999 to 2010, you can see following this, the opioid deaths, cocaine deaths, and heroin. You can see the opioids are on the increase. Heroin is on the increase. but then cocaine is on the decrease. So when people cannot find or get prescriptions for the opioids and they're addicted, they go to the street and they get heroin, which may not be very pure, and it may be even more toxic depending on your supplier and who you're getting it from. So it can have even worse side effects here. So what you should know is opioids now cause more deaths than any other drugs today. Americans, this is one of the most important points that I'm going to make here, and this is really speaking to the insanity of our sick care system today, is Americans represent 4.6% of the world, but consume 99% of world's hydrocodone. That's Vicodin. 80% of the world's oxycodone or Oxycontin, and 65% of the world's hydromorphone. But yet we have less than 5% of the world's population, but we're consuming 99% of these drugs. The definition of insanity is doing the exact same things over and over and over and expecting different results. When you start looking at the science and you start looking at the facts, a different story starts to get painted than what you might see in the media or what might be missing in the media today. So death due to opioids, overdose deaths involving prescription opioids have quadrupled since 1999, as have sales of these prescription drugs. And from 1999 to 2014, more than 165,000 people have died in the US from overdoses related to prescription opioids. Which, to put it a little bit into context, is my dad was in the Vietnam War. That's 3 times the US military deaths during the 20 years of the Vietnam War. And in 2016, the National Safety Council survey found 99% of medical doctors prescribe highly addictive opioids and for longer than the 3-day period recommended by the CDC. You can see this is a massive problem. Now, look, I know plenty of medical doctors who are great people, kind heart, and they're looking to serve their patients with the best of intentions. But if you're in a system, a broken system, where then you have big money backed by big pharma influencing the education of these very intelligent individuals that are teaching you how to prescribe drugs to your patients and push them more, this is where then a crisis then starts to rise up. And you have good people in a broken system, the outcomes are not going to be highly desirable. So let's not underestimate our capacity to get it wrong here. At one time, doctors specifically were recommending cigarettes. It seemed to be okay at a time. And then these are just different ads from the past. And so you just look at this, and at one time we thought something was okay, but maybe it really wasn't. And we have to start asking what is really the intention behind this. Even the dentist would recommend certain types of cigarettes. And we all know today of how bad smoking is. So there's a huge conflict of interest here. The AMA, which is the American Medical Association, and Big Pharma, they're in bed together. They're tight, just like this. One system feeds the other system, and it feeds other systems out there. But we're going to focus on the AMA and Big Pharma. Now, I asked a couple patients about this, and some patients actually knew about this, which I was surprised. But October 2020, which was about 10 months ago, Purdue Pharma pled guilty to 3 felony counts of criminal wrongdoing and settled with the Department of Justice for $8.3 billion over production and marketing of Oxycontin and other opioid drugs. Now, here's the kicker, is with this settlement, they're hoping to win immunity from any future opioid lawsuits. Now, if we go back in history, back to 1986, there is an act called the National Vaccine Injury Act. And at that time, The irony of the vaccine manufacturers, the pharmaceutical companies that produce vaccines, were seeking immunity, see the irony there, from the government of any future vaccine lawsuits. This is real, folks, is that if somebody is injured because then they receive a vaccine and have a side effect, the pharmaceutical companies that manufactured that vaccine have protection. It starts to make you question who has what interests in mind when it comes to healthcare. Is it your best interests or is it profit? Purdue Pharma gave over a $3 million donation to the AMA and the AMA Foundation. In doing so, this helped influence the AMA's pain management training program to make it easier for physicians to prescribe opioids to their patients, including a plan to expand their market and then start prescribing drugs to children. And we start to see in the young athletes today that are suffering with pain, it's very easy for them today to get opioids and then start to get hooked on opioids. I don't know about you, but I have children. And if it seems like I'm yelling here, I'm not yelling at you. I just get very passionate about this information because my children are part of that generation. And I want to do everything that I can to help influence better health outcomes for them and for you and for your families too. Quite frankly, it's sickening. So the president of Purdue Pharma, Richard Sackler and the family, he specifically served on the AMA Foundation's board of directors. So can you see how there's a conflict of interest? The AMA owns, operates, and profits from the CPT codes. It's a 5-digit code used for billing medical procedures and services. So for instance, during this pandemic, the COVID pandemic, if somebody goes into the hospital and then they receive a diagnosis of pneumonia, let's say, and it is standard treatment to then put somebody on a ventilator. Now, my numbers may be off, so please don't quote me, but I'm pretty close here, I believe, from the research that I've done, is you might get reimbursed about $11,000 for treatment of that individual. But if somebody comes into the hospital and they're diagnosed with COVID and the ventilator is recommended or pushed, then you might get $35,000 in reimbursement. These are the things that are happening on the backside, which then makes us wonder, about our healthcare system and what are the intents of the people that are in charge leading this. The AMA is regarded as the preeminent voice in US medicine, but it uses its commercial profits for political purposes like lobbying. There's actually more pharmaceutical lobbyists today than there are congressmen and women. Their pockets go deep and they go wide, and they will continue to lobby for the interests of creating more bottom line revenue. Because at the end of the day, when you have a public company, isn't the idea to create more bottom line revenue for the stakeholders? But what about people's health? What about people's well-being? What about contributing to our problem here today rather than solving it? So again, chronic pain for greater than 3 months. So in my opinion, we need to be asking better questions because the quality of our questions will drive our behaviors, which ultimately lead to our outcomes. For instance, when somebody asks me, should I take an opioid drug? Should I take a painkiller? I have to ask, what's your goal? What are you trying to accomplish? So you may be wanting to ask, what are the risks involved of a procedure or a drug? What are the costs involved? What are my expected outcomes? May I interview 10 of your patients? What does the research, good research, actually have to say about this? What are my options? Is this my only option or are there options? In my world, this is what's called true informed consent. Is this treating my symptoms or is it actually correcting the cause of my problems? So are we masking the real problem? I don't know. What do you think? Do you think with these opioids, we're masking the real problem? I believe we are. So the chronic pain or pain greater than 3 months is simply the body signal of the underlying root issue. It's the tip of the iceberg. So there's a reason why your body produces pain. And if we just try to cover up the pain, you might temporarily feel better while your body is becoming worse, while the underlying problem is becoming worse, and you're getting sicker and more unhealthy and weaker. So what do we do? Well, the CDC guidelines and the National Pain Strategy share an important element to address the out of control opioid environment in the US. They're encouraging medical doctors, legislators, and consumers to utilize non-pharmacologic conservative care. Well, chiropractic's been saying that from day one. And I don't know if you know this, but September 18th, we're coming up on chiropractic's birthday. His profession is relatively young. Back in 1895 was when Dr. Palmer found a subluxation or misalignment in the janitor of the building's neck. Now, what's interesting about Harvey Lillard, the janitor, was that Harvey Lillard he wasn't born deaf, but he became deaf after he lifted something over his head and he heard a pop in his neck. So Dr. Palmer, in the roots of chiropractic, was looking for more natural, holistic approaches to awaken the body's innate healing potential and to help optimize it. So Dr. Palmer, in his research, discovered that if a bone's out of alignment, putting pressure on the nerve, wherever that nerve goes, that part of the body is not going to work properly. So as it goes down in history, he made an adjustment. The guy heard a pop in his neck and could hear for the first time in 16 years. Chiropractic, right from the beginning, is and still is all about a non-drug, non-surgical approach to improve your well-being. Here's the cost of pain. 60% of people in America take prescription drugs. I don't know about you, but that does not sound like a healthy society. To me, it sounds like we have a problem nobody is talking about. We got a sick nation that's continuing to get sicker, that is fed by certain systems out there like pharma and big agriculture and the food industry and the insurance companies over and over and over to keep people sick rather than help people get healthy. Because let's face it, if you are healthy, you're not going to be a customer of the pharmaceutical company. Now, there are 77,000 chiropractors in the United States, and chiropractors offer first-line treatment for pain to avoid opioids getting prescribed in the first place. We don't do any drugs. We don't do surgery. And to be a chiropractor, it's 7 years of year-round schooling, higher education to learn what we know to help serve our patients and continuing education along the way. So chiropractic helps prevent the introduction of drugs. Just like the DARE program back when I was in elementary school, just say no. So why chiropractic? Well, let's take a look at musculoskeletal disorders, disorders of the spine, disorders of the nervous system. We're focused on that. And these disorders impact 44.6 million Americans annually with an estimated cost almost $270 billion and are increasingly the result of poor posture, workplace and sports-related injuries, car accidents, and simply sedentary lifestyle. My question is, since COVID hit the last 18 months, have these problems gotten worse or worse? Absolutely. These disorders often get prescribed pain medication. Take this pain medication. If the problem's still there in 6 months, come back and see me. That's what patients report to me that their medical doctors say often with their pain disorders. Chiropractic is a much safer approach for acute, subacute, chronic pain, but chiropractic goes beyond just the pain approach. Chiropractic is a health lifestyle strategy for human beings looking to become healthier and stronger. Chiropractic leads the charge. This is what we talk about when we're third-tier healthcare here. You see, the first tier of healthcare is the treatment of disease. This is to manage the symptoms. This is to prescribe the opioids. And it's also to help people from dying. This is treatment of disease is what, it's being treated of all these chronic conditions, diabetes and obesity and heart disease and cancer and Alzheimer's. It's the treatment of these diseases, high blood pressure and inflammation and things like that. Then you have the prevention of disease is the second tier. I don't know. That's what we've been told to do is wear masks and no high fives and no hugs and no handshakes and frequent hand washing. I'm not sure that all that does anything to prevent disease, but let's just say it does, and maybe it is appropriate in certain times. That's the prevention of disease. That's the brushing and flossing that your dentist is going to talk about. Then third tier healthcare is what we talk about. This is what we speak at Pure Chiropractic in our office. This is the promotion of health. This is the activities to start doing to help your body become healthier and stronger. This is your lifestyle. These are the things that we tell you to stop doing because your lifestyle is screwing up all the work that we're doing for you when it comes to your care. So this is the promotion. This is about getting healthier and stronger. And remember, the longer you're sick, the sicker you become. But the healthier you are over time, the healthier you become. So these things are a trajectory that build over time. So where are you at? Where are you at on the health and wellness continuum? Where are you at when it comes to illness and disease? Are you on the far right side of optimal high-level health and wellness? So let's say at a +10. Are you in the middle at a 0? Or are you close to the premature death, wearing out before it's your time at a -10? You see, wherever you're at, be real with yourself and then take a look at over the last 18 months, what have you been doing to improve high-level health and wellness? Remember, no judgment here. For many, you didn't know, but now you know, you can make better decisions. So maybe you're already at high-level health and wellness and you dug in and kept doing the things over the last 18 months to keep you healthier and stronger. But where are you at? Have you been making the changes that you know you need to make? And if you're not sure what to do and you don't know what to do, which I believe you do, but if you don't, then come ask me. I'll tell you what you need to do to get healthier and stronger here. But by the time we have the symptom, we're one step away of a disability. And the longer that we're chronically disabled, the faster our time is going to expire here. So symptoms tell us what direction we're heading in. If you're like me, you're wanting to become more aware, more educated, and you want to grow in your health and wellness. That's what these wellness webinars each month are all about, giving you 60 minutes of space to slow down, assess where you're at, plan, prepare, execute the next month towards your health and wellness plan, and then reassess. That's what we call our appear process in goal setting here. Keep in mind, when it comes to your health, we can tell more about your health based on function in your body rather than feeling, because pain is only 10% of your nervous system. The other 90% control muscles and control the organ systems within your body. So do you have other options than opioids for pain management here? Well, let's take a look here. Let's finish up the video that we started earlier.
Out there. So what can you do if you're in pain? Current guidelines promote avoiding drugs and surgery if you have pain. And instead, one of the first line choices you should look at is manual therapies like chiropractic care. Chiropractic care is well known in the research literature to help people who suffer with neck pain, back pain, and headaches. And research has shown us that people who go to see a chiropractor are far less likely to take opioid medication. In fact, a large recent high-quality study reviewed all the scientific evidence about opioid use in people who see a chiropractor. When the researchers in the study put all the evidence together, they found that people with back pain who saw a chiropractor were 64% less likely to receive an opioid prescription. Considering how harmful opioid medication can be, this is a really important finding. If you go and see a chiropractor when you're in pain, you are much less likely to need to take opioid drugs. That has got to be a good thing for you. And don't forget that chiropractic care has so much more to offer than just helping you with your chronic pain. Chiropractic care is all about improving the communication between your brain and body so you can function at your best. But if you are suffering from pain, don't reach for the pill bottle. Instead, do your best to stay positive, move often, eat well, sleep well, and go see your family chiropractor.
Okay, so I hope you see the big idea there. How about that? Those that sought a chiropractor to help them, then there was a 64% reduction in prescription opioid use. I think that's pretty phenomenal. Now, where does your health come from? Well, your health comes from your nervous system. It's your nervous system that's the master system that controls and coordinates all other functions in your body. If there's an insult, an injury to your nervous system, any interference, it is going to innately, your body is designed to create pain. Pain is a survival mechanism. Now, there's conditions out there where people cannot experience pain. You can imagine how miserable their lives can be. Because if you're injured, how do you know you're even injured? You know, there's a reason why we're in pain at times. It's to pay attention inside now. It's our body's alarm system. But if your nervous system has an insult to it and it's not functioning well, you're not healing well either. And you're moving away from optimal health. And it's your nervous system that processes and copes and adapts to all the stress that you're under day in and day out. See, there's a stress response that's elicited through your nervous system. And when you're under chronic stress, physically, nutritionally, mentally, emotionally, your physiology adapts. One of the things that goes up is your anxiety. I cannot tell you the amount of anxiety and anxiousness experienced in my patients and even in my own life, and the fear out there. And I consider myself a pretty well-grounded individual. So I can imagine those individuals that aren't as well-grounded and the fear and anxiety they're experiencing. That's why we're here to offer hope and encouragement. But when you're under stress too, your immune system goes down. I don't know, you tell me, is it a good idea to be immunocompromised these days? Like, I think it's amazing how people think it's a shock that the virus that's out there and there's a variant. Well, that's what viruses do. That when we're trying to kill the virus is going to adapt and mutate. That's what viruses do. When we start messing with nature, that becomes, and I'm not sure that's the best idea when we're trying to produce our optimal health and well-being. Increased sensory systems, that's heightened awareness of pain when you're under stress. When you're under stress, you're going to be more sensitive to pain because your body's trying to catch your attention. And there's other factors here, but those are the three that I wanted to point out when you're under stress. Our premise in the office is that healthy is normal, sick is abnormal, but sick has become the new norm. And your body is smart, it's intelligent, and it's your nervous system that carries that intelligence throughout the body. And your spine is your suit of armor. So if you want to be as healthy as possible, you have to have a healthy nervous system. And in order to have a healthy nervous system, you have to have a healthy spine. And it's that spine that protects the nervous system that helps you adapt to modern stressful living. Hands up if your stress has gone up over the past 18 months. Everybody that I've spoken to, hands are going up. Sometimes their feet too, because of how much stress that they're under. Now that stress could be microtraumas caused by car accidents. It could be slips and falls. It could be yard work, something physical. It could be sports injuries. And even being born can create a macrotrauma in the spine called subluxation. But today, the microtraumas are when we're attached to our cell phone here and exhibiting poor posture. And that over time these microtraumas start to lead to big interference into the way that our nervous system is functioning, which then ultimately then affects then our pain signals in the body, and it'll increase the pain. Remember, sitting is the new smoking. So for most, we're living busy lifestyles so that it's a lot easier to reach for the bottle of over-the-counter or prescription pain meds than it is to actually take time to slow down and then seek the cause so you can find the appropriate solution to your problem. And let's face it, the insurance industry doesn't make it any easier, because then your copays or your insurance benefits pays for this crisis intervention. But then they're not paying for the wellness care that you deserve to prevent the problem in the first place. So that's why when I talk to patients is that they may be choosing the opioids because it may ultimately be less expensive in their pocketbook, but long-term, it can cost them everything, including their life. It's not uncommon for me to have patients say, hey, doc, my insurance is ending, or I'm changing plans, or so on and so forth. Should I get this surgery before my insurance is up? What's your goal? What are you looking to accomplish? I just find it fascinating. And the point is how our health care or sick care decisions are based on what insurance does or does not pay. Now, I know that each and every one of you that are on this call this evening are action takers and understand what I'm talking about. So I want to honor your investment to your health and well-being, but you get what I'm saying. Subluxation is caused by stress to the spine that the body cannot adapt to, and it starts to impact the communication systems, and it starts to affect the way that your health and self-regulating system in the body is working. Subluxations are joint misalignments that cause nerve irritation, inflammation, soft tissue damage, muscle spasms, loss inhibition, joint fixation, and ultimately pain is the end result of subluxation. Can you have subluxation without any pain? Absolutely. In fact, one of the most common signs or symptoms of subluxation is no symptom at all. Just like with tooth decay, tooth pain, is that an early or a late sign of a problem? What do you think? Well, that's a late sign of a problem, just like heart pain. Is that early or late sign of a problem? It's a late sign, absolutely. So pain is a late sign of a problem here. So remember, adaptive physiology, when your body is stressed, increases the pain syndromes in the body and downregulates your immune system. 10%, less than 10% of your nerves sense pain. So how do you know if you have subluxation? So you know this by getting checked. And many of you have been checked. And if you haven't been checked, I extend an invitation to consider coming in and finding out if your spine is subluxated, and that if there is interference in the communication of the nervous system, that is decreasing your body's optimal ability to heal and express health. And we do this through 5 criteria. We have instrumentation that we can objectively measure how your nervous system is adapting to stress. We can run the spine through specific ranges of motion and movement, feeling the muscles along the spine for tenderness and swelling and edema. We look at your posture. Your posture is a window into your nervous system, and we can concretely see exactly what's going on in your spine through the use of x-rays. That can confirm exactly if you have subluxation and how long it's been in the spine. So we can give you an idea how long it's going to take for your body to become healthier and stronger. So here are some of the do's and the don'ts to help your body function better and to then eliminate pain. So in addition to chiropractic care to improve your overall health and well-being, there are many other ways outside of opioid drugs to help manage your pain, but then also help you achieve higher levels of health and wellness. Keep in mind, this is not an exhaustive list here, but these are some of the more common things that you can be seeking to help support your chiropractic care, such as yoga, meditation, mindfulness, massage or physical therapy, exercise, acupuncture, Tai Chi, or cognitive behavioral therapy. All these have been proven to reduce pain syndromes within individuals, but beyond that, it's about increasing your body's health potential. So the three-legged stool of best results in our office are as follows. Keep your adjustments in rhythm. So based on our objective findings and what your health goals are, the doctors will go ahead and give you specific recommendations for your condition. And the most important thing you can do with your chiropractic care is keep your appointments in rhythm. If you're skipping or missing appointments and not rescheduling or making them up, the problem is that you're falling behind in your care. To get my best work, Dr. Travis's best work, is to keep your adjustments in rhythm. Each one of these adjustments builds momentum off the previous adjustment. Missing an appointment is going to slow or delay the healing process. Then it's about identifying bad habits that are causing your subluxation patterns in the first place. And then the third leg is to exercise to help strengthen the muscles along the spine, help your adjustments hold better. So I know that many of you are curious if you're watching this now and you're not currently a patient, or if you're watching this later and want to know is if you are subluxated and want to know that you're doing everything that you can to improve your health and optimal health outcomes, we recommend that you go ahead and you get checked. Lastly, in closing here is I want to thank you all for taking time. I hope that you received tremendous value in tonight's presentation, that it'll help you on your journey towards your optimal health and wellness goals. If you are unclear of what you should be doing outside of the office to help support your chiropractic adjustments and care and continue to optimize your nervous system, then please ask. I'm certain you do, but please ask. Consider attending these monthly webinars, continue attending them so you can continue to get more health information to make sure you're doing everything you can to strengthen your body. Now more than ever, you want a strong body, a healthy body, and you want to continue to keep that health and grow that health, because your health, you're not at stasis with your health. It's either you're getting healthier and stronger or you're getting weaker or sicker. And along the way, it's about progress, not perfection here. Again, no judgment wherever you're at on your journey. Maybe before this presentation, you just didn't know, but now you know. And knowing, it's about taking responsibility, and that's super empowering, that you can actually do something to improve your health and well-being. You can do something to improve your immune system function, to strengthen your body. And you don't have to succumb to being a victim of the system and waiting for others to do the work, because they're never going to be able to do the work. If I could do the work for you, I would. But this is a we program. Remember, I in illness, we in wellness. So thank you for attending. If you are looking for some direction, you know a loved one or family member who is struggling, they have pain, they're looking for a better way to better health, avoiding drugs, avoiding surgery, I'd love an opportunity to see if I could help. So please introduce me to friends and family and loved ones. And if you know somebody that needs help, but they're not in the area, come talk to me or Dr. Travis. Likely we'll be able to refer them to a wellness chiropractor where they're at. But if you are a loved one who's struggling with an opioid addiction, just know that there's help out there and you're not alone. Here's a substance abuse mental health service administration. They can be contacted 24 hours a day, 1-800-622-HELP, 1-800-622-HELP. Because there are things out there like low dose naltrexone, when in microdoses, can help combat opioid addiction. And you're going to do this with a physician who then set you up with those opioid drugs in the first place. So I wish everybody a happy end to your summer. It's hard to believe that we're at the end of summer months here. I just want to tell you that winter is coming. So if you were ever to decide and make a decision to become healthier and stronger, and if you were to ever double down on your health and wellness activities to make your body healthier and stronger, Now is the time. Folks, the flu season is right around the corner. And combining that with COVID and what they're telling us to do and things like that on the outside, I'm telling you, is that now is the time to invest in your health. Now is the time to strengthen your body. Now is the time to optimize your nervous system function in the way you eat, the way you move, the way you think. Stay consistent with your chiropractic adjustments, optimize your sleep, optimize your supplementation, optimize your stress management, be around loving, supportive people, be in a positive, hope-filled environment, because winter is coming. Now is the time to build your health and wellness bank account. And if you, as they say, is that you'll be very glad you invested in your health and wellness if you become sick. When you're sick is not the time to say, oh, I shoulda, woulda, coulda. Now's the time to invest in your health. So I love and appreciate each and every one of you. Thank you so much for joining in. Share this information with one or two people that you know that can benefit from hearing this. And I look forward to seeing you in the office soon. Make it a great night. And just remember, for you and your family's health and wellness, we've got your back. We'll talk soon. Thank you so much.